Welcome to adapting class number 14. Commonly tested topic, high yield. Questions that you need to know are based on content with brevity, very small as much as possible, test taking strategy, adapting class way. Let's get to it. And let's provide care for a client with diabetes insipidus, which finding the next you expect. You should know this by now. If you don't, check adapting class. This is a content-based diabetes insipidus. There's no ADH. ADH, right? You're going to lose all your water. What is the major problem? Dehydration, right? If you're dehydrated, neck vein is flattened. Your urine specific gravity is not going to be this. 1.1035 is concentrated. This is the normal value, right? 1.003 to 1.030. If it's greater than 1.030, that means it's concentrated. When you diabetes insipidus, you're pouring out a lot of fluid. Your urine specific gravity is going to be diluted. Therefore, I don't expect that. Your serum sodium is going to be high. You don't need any more 3% of normal setting. If your serum sodium is high, we need to give you water to dilute it. No free water restriction. So number one is right answer. This is the way they can ask you questions without the select or apply you should expect, but this is the taking strategy way. Same thing, I decided not to give you select or apply. One question, think about it. Which finding the next you expect, right? And let's provide care for a client with what? Chronic venous insufficiency. What is the problem with chronic venous insufficiency? Too much blood. That means edema here, right? Brownie pigmentation. You have a beefy red ulcer. Your pulses is going to be normal. Toe ulcers are classic for PAD. Normal pulse, PVD. Decreased pulse, PAD. Calf pain when you're walking, PAD. Straightforward content. I expect you to know that this is the concept I'm using to answer that question. You see. What is the next one? After orientation in the cardiac unit, a new graduate will elect which finding as consistent with what decompensated heart failure. When you see this complicated statement question, break it down. What is decompensated heart failure and what would I see? If they don't tell you it's right heart failure, they don't tell you if left heart failure, that means it's both. Is heart failure, chronic heart failure. That means you can see right-sided and left-sided. Decompensated heart failure will have right and left. Therefore, leg edema is right side. JVD, right side. So this is all right side. Dyspnea on exertion is the left side. Atopnia is the left side. Gone. Long crackles is the left side. JVD is the right side. Hepatomegaly is the right side. Weight gain is the right side. So 3 is your right answer. This is the track and let you think and know the diagnosis of decompensated heart failure. This is the same thing. And let's provide care for a client with new onset of what? Chest pain radiating to the left jaw and shoulder. These are questions set by me. So if it sounds difficult, yeah, I want to make it difficult so that when you take the test, it's easy. Which lab value is consistent with the heart muscle injury. This is the concept. This is your heart. This patient looks like he's having heart attack. How do we do when we do heart attack? What do? We get a cardiac enzymes, right? What are we looking for? We're looking for troponin. We also look for creatinine kinase because it's a muscle, but we're looking for MB, right? That is the most important. Creatinine kinase, this is all muscle. Creatinine kinase, brain, this is all from the brain. Pony is better. Myoglobin is due to muscle injury, specifically like in rhabdo, but not this one. So this one is the right answer. Number 2, troponin. And let's provide care for a client who will report for straining at stool, infrequent bowel movement after iron tablet for anemia. Which intervention is appropriate in the plan of care? Break it down. I give you iron. You know what is going to cause, right? Constipation. So you straining, infrequent bowel movement, and you attach to. You have what? Constipation. What is the management of the constipation? A lot of water, some fiber, and exercise, right? Vegetables is good. Water, moderate exercise once a day is wrong. Moderate exercise means walking 30 minutes. So it's not enough. You got to do it what? What do you think? 3 times a week. So I try to tripe you. What do you think about it? Moderate exercise once a day. That means this guy is doing it what? 5 days. Therefore, he's doing more than you need to. Be careful of this kind of statement. Moderate exercise means you're going walking 30 minutes 3 times a week. So you're doing just 3 times. You do it once a day, 30 minutes once a day. So every day of the week, he's doing it. So he's getting adequate exercise. Avoid psyllium. Psyllium is fiber. You should not avoid it. Recommend Docolas? No, daily. We don't want you to take anything to stimulate you. We want some fiber and water. That's all. So 1, 2, 3, and 4 are your right answer. And let's provide teaching to a client on lithium for mood disorder. Which statement by the client indicate teaching is effective? Right? It's an effective teaching. I forget to put effective. For which teaching is effective? Effective teaching. That means if you're taking lithium, don't do anything to your kidney. That will affect your kidney. And number one problem is a GI symptoms. And what is GI will lead to? Dehydration. Therefore, anything that will lead to dehydration coming from the GI or you doing it that affecting your kidney is affecting lithium. You see how everything is connected? GI causes dehydration, dehydration affects your kidney, and lithium get bad. I will call if I have a stomach bug. Yes, diarrhea. I will drink 2 to 3 liters of water a day. Yes, I got to make the kidney happy. I will take what? I will take ondansetron for intractable nausea. When you have nausea, that's GI symptoms. Number one signs and symptoms that is toxic means GI. Therefore, don't take ondansetron. Call me. So this one, teaching is not effective. I will avoid Motrin. It affects your kidney. Teaching is effective. I'll stop the lithium when I feel better. No, it's a mood disorder. You're going to take it the rest of your life. If you don't take it, you're going to mania. So 1, 2, and 4 are your right answer. Number 7. And let's evaluate the G1P0 at 88 weeks gestation. Which prescription in the nurse should further investigate? That means something is wrong. You should not be on this medication. Should further investigate. You 8 weeks, you're pregnant. You should avoid certain medication. Motrin is fine until you get to the third trimester, where it can cause premature closure of the ductus arteriosus. So at this early stage, Motrin is okay. I don't need to worry. Bencinopro, yeah, is teratogenic. Warfarin is teratogenic. Valproic acid, teratogenic. Folate is good for neurotube defect. It's going to counteract valproic acid. And as to treat acne, it's also bad. So 6, 4, 3, and 2 are your right answer. 1 and 5 are right. They okay. You don't need to further investigate. And this is preparing to admit the client with pulmonary diphtheria infection. Which intervention the nurse should include in the plan of care? Selected, apply. Strategy, strategy, strategy. Selected, apply. Intervention. I'm talking about pulmonary diphtheria, right? That's the reason why I put pulmonary. It's a long problem. What do you have? This is what? Droplet precaution, right? I don't need negative pressure room for droplet. I don't need N95. The client wears surgical room, surgical mask for X-ray. That's excellent. You don't need to use single-use equipment. Somebody will say, well, do I take one equipment for the adult patient room and go to the other room? For your board, when it's droplet, single-use equipment means they're talking about equipment that most of the time we use it all the time. But for this if it's a contact, we use single, like a gown, like a stethoscope. That is, you cannot use it on anybody anymore. A patient with droplet, you can use stethoscopes and move it from another patient to another. All you need to do is to clean it. So when it says single use, it doesn't mean you go to one patient room and then you take it to another room. Single use equipment always is related to contact precaution. This is no contact. And perform hand hygiene before and after care. No brainer, right? I never say soap and water. I say hand hygiene. Everybody get a hand hygiene. And then assess a client after leg cast placement, which finding is concerning. I like brevity of questions, very short, right? Why? Because it's well taught and it deal with content. All I want to ask you, what do you know when you catch somebody? The foot is warm. Hallelujah. I like you. Plus 2DP, test taking strategy. It's the same thing as your foot is warm. Word cast. I don't like it. But when you have pins and needles, I have to be sharp. That is my answer. Pins and needle, I have to be sharp. But word cast, I hate it. Thus, I love you. So that's those things. 1 foot and plus 2DPs is good. Word cast is bad. But pins and needles, the baddest of all. I'm being sharp, right? That's prioritization 101. And let's provide teaching to a client. There should be two. To a client with a good, right? I just made the question, so sometimes to a client with gastroesophageal reflux, which teaching made by the client indicate the teaching was effective. Provided teaching is effective. Reflux means you have your stomach and the gastroesophageal junction, and this usually there's loss of sphincter and make ensure food stay in your stomach, so things can reflux. Spicy food, you should stop it. You don't cut it down, right? You take your medication 30 to 60 minutes before meal. That's good, so they can help with the acid secretion, right? I will go to bed a few hours after eating. No, you wait. You don't go at least 2 to 3 hours before you sleep. And dairy product is not part of the gastroesophageal reflux. It's a trap. So the right answer is number 2. Number 14 is that take care of yourself. Keep charging as always. All the best of luck. Thank you very much.